everyone, welcome to our webinar under Typhoon Signal number 3 in Hong Kong. The topic of our webinar is Will the World Ever Be the Same Again? And it's hosted by the Consulate General of Sweden in Hong Kong. I'm Akina Fong and I will be your moderator for today's webinar. In the following hour, we will discuss the future of the pandemic in a global perspective. And your participation is essential as COVID-19 is affecting people from all walks of life. And we have invited two experts to join us today, and I will introduce to you later on. As all of you know, COVID-19 continues to impact all of us and governments around the world. And we are still working for the ways to combat the virus. A lot of the discussion have been focused on the different strategies being applied. But more and more of the focus have shifted to become more forward-looking. And what will our future be like in 2021 and beyond regarding the pandemic? How long do we have to cope with the new normal? Or are the changes in how we travel, work, and social interact something that will stay with us for overseas or foreseeable future? So the Consulate General of Sweden in Hong Kong has invited two well-known epidemiologist experts, Dr. Tegnell from Sweden and Professor Gabriel Leung from Hong Kong, to share their thoughts and exchange ideas about how the future global development of the pandemic will look like. And first of all, good morning to Dr. Tegnell. Hello, Dr. Tegnell. It should be 9:30 something a.m. in Swedish time, right?
That's correct. Very pleased to be here and very pleased to meet with Professor Leung.
Yeah, our honor to speak to you as well. And also good afternoon to Professor Gabriel Leung, who is sitting next to me.
Thank you. Thank you. It's a huge pleasure. Thank you to the consulate here in Hong Kong. And of course, thank you very, very much indeed to Anders from all the way across many, many thousands of miles. But we have all learned a huge amount from your experience. Thank you so much again, Anders.
Yes, right now it's 3:35, in Hong Kong time. It's a pleasure to meet you two online, and I'm sure that we'll have a very fruitful discussion. And let me introduce you both to the audience. Dr. Tegnell is the head of the Department of Public Health Analysis and Data Management, Deputy Director General at the Public Health Agency of Sweden and Swedish State Epidemiologist since 2013, and he is a medical doctor with a PhD in infectious disease. Dr. Tegnell has extensive experience of leading different Swedish government agencies at different levels in the field of public health and disease control, and has also experience from international work, for example, from Laos in 1990 to 1993 for WHO, and from DRC during the Ebola outbreak in 1995. And for Professor Gabriel Leung, is the 40th Dean of Medicine, the University of Hong Kong from 2013 onwards, inaugural Helen and Francis Seaman Professor in Population Health, and holds the Chair of Public Health Medicine at Hong Kong U. And he was the last head of community medicine from 2012 to 13 at the university, as well as Hong Kong's first Under Secretary for Food and Health from 2008 to 11, and fifth Director of the Chief Executive Office from 2011 to 12 in Hong Kong Special Administrative Region Government. And currently, under the COVID-19 pandemic, Professor Leung is one of the members of an expert advisory group to provide professional advice to the Chief Executive and the Hong Kong SAR government. Wow, very, very long biography. To start with, may I invite both of you to spend around 10 minutes to share your views on the following issues. First of all, what has worked or not worked so far in combating the virus globally? And what is your prediction on the future global developments of the pandemic? And also, what are your thoughts connecting global solutions and collaboration? May I invite Professor Leung to share your views first?
Sure. So let me try to address each of your questions in turn. I think in order to understand what has worked or has not worked, one has to understand the epidemiology of COVID-19. So we were very privileged to have worked alongside the China CDC very, very early during the pandemic. In fact, even before it was called COVID-19. So I remember very distinctly that towards the end of January, we had worked so intensively with the national CDC here in China, and we in fact put out the first epidemiological report about the disease, even before it was named. And since then, we've learned a huge amount about the epidemiology. We know that this is not SARS, this is not influenza of any variety, this is just COVID-19. And by that, I mean, there are some distinct differences. So for example, when people say that, how do you compare COVID-19 with SARS? Well, you can't, because SARS in 2003 to 2004 globally had a total case count, that is the number of people who had been infected and registered with the disease, at just shy of 9,000. And in that time, you are looking at 9 months of the outbreak globally, registering a total number of cases that is a fraction of some countries' daily incident case count currently for COVID-19. And the key difference is the way it spreads. So if you remember back 17 years with SARS, it's usually about 5 to 7 days after the onset of symptoms in a patient with SARS that they start to shed a lot of virus and therefore spread it to others. Whereas the same thing for COVID-19, peak viral shedding is actually at the time of symptom onset. Whereas about 30 to 40% of all of the secondary infections actually take place before symptom onset. So you can see why it is so much more difficult to try to control COVID-19 as opposed to SARS, where for SARS, you had almost a week after somebody becomes ill for you to test, confirm, isolate, and then quarantine their contacts. Whereas for COVID-19, despite best efforts, you probably can't do it nearly as well. And that's why we've now registered well over 40 million of cases worldwide, and that's probably a small fraction of the total number of people infected. So that's one key difference. In terms of the comparison with flu, we were also very fortunate to have had the privilege of working out the clinical severity in terms of the fatality risk of COVID-19, really very early on using data from Wuhan in the middle of China, the original epicenter. And there we were able to show that actually COVID-19's case fatality risk, whichever way you measure it, but if you compare it apples with apples, head to head with all of the influenza epidemics and pandemics, it probably is 10 times or even 100 times higher, depending on which influenza season or pandemic you compare with. So this is much more deadly and serious than influenza. And so those are the two things that really mark it out. And then finally, let me just say that the coronaviruses generally, but specifically COVID-19, actually is highly over-dispersed. Now, over-dispersion is just a technical jargon to say that it spreads in clusters. That is, it's very clumpy. And therefore, what we have also found out, looking at Hong Kong data, which has been replicated elsewhere, that about 70% of infected people don't actually spread it to anybody else. The vast majority of the secondary cases are actually infected by about 20% of the individuals. So you get very, very large clusters and very clumpy outbreaks. And that is why, as we're now beginning to see in government policies around the world, it's really the control of the very high-risk settings in particular that actually makes the most difference in terms of outbreak control. Now, having said that, every country has got a slightly different objective of their infection control effort. Some countries would go for near elimination. So places like New Zealand, places like mainland China, Taiwan, and Hong Kong, and indeed Singapore, these places have actually gone for near elimination. And so the things that these places do is very different than what some other places do, either because these other places have got such large growing epidemics and because of the contextual differences that they don't aim for near elimination. They aim for mitigation and suppression. And so that's why you see a wide variety of approaches to lockdowns, physical distancing measures, and so on. And I think that my final comment is, whatever you do, it's a three-way tug-of-war, always, as we have done over the last 10 months, and as we will continue to do, likely for the coming year or more. The three-way tug-of-war is between health protection, economic preservation, and the implied social consent of your population to go along with whatever measures you put in place to control the pandemic. And these three forces, while not exactly orthogonal, they actually have tension because they don't pull in the same direction. And so as we all sort of ride those waves of infections between now and when it might settle down a little bit more with the first generation of vaccines, we are going to see that it will be these three forces that will be tugging at each other. And at any one time, in any single context, it would depend on the circumstances to see which of the emphases are being considered more as governments design and implement these policies.
Yes, it seems that COVID-19 or coronavirus is part of our life right now. And so later on, we have a question and answer section that two experts may express your views further. And thank you very much, Professor Leung. And right now, I invite Dr. Anders Tegnell to share your thoughts.
Thank you very much. And thank you, Professor Leung, for your very insightful description of what we are facing right now. Since you have done that, and I agree to what you have been saying, I'm not going to say that again, but let me take a slightly different angle to the questions you sent us. And let's start by thinking about what have we done right this time, which I think is quite interesting because you mentioned SARS, we also had a swine flu pandemic. There has been a number of occasions in the past, which we have handled in different ways. But of course, every situation is unique and you can't handle them the same way. But I think there is differences when you look back. And I think that the world has become much better at sharing information, which you also mentioned in the beginning, both from China and from Hong Kong. I think the rest of the world learned a lot very early on by the description of the disease, description of the epidemiology that you supplied with the rest of us at an early stage. And I think that was crucial and was a big difference to earlier times when this kind of information was much more difficult to get hold of. So I think that this exchange of information is something we really need to take with us into the future, because I think it's so essential that we try to understand this very different and very unpredictable wave of a new virus that we are seeing right now. So I think that's very important and has happened very well so far. There has been a huge amount of research I think one of my colleagues counted and said there was around 300 new papers published every day, which is of course an incredible amount and impossible for anybody to follow. It is also that a fair amount of this research has not been all that good. We also need to realize that, and that has created some problems. That there's been a lot of rumors out there, both about what therapeutics are going to be useful and other things. And I think once again, by working together on a global level, we can stop those kind of myths from dispersing too much. I think it was also very good that we very early on could share data on the virus. That has, I think, helped the world all over extensively to be able to develop diagnostics, which has been so important in the fight with this virus from early on. We do see also some, I think, fairly promising discussions around the development of vaccine, and also that hopefully we can find some way of using the vaccines together on a global level to diminish the spread of this disease as much as possible. But as Professor Leung also said, there is a huge need for sustainability right now, and any kind of signal or idea that we're going to find a quick, easy solution to this pandemic is of course completely wrong. We're going to have to work with this at least for another year, maybe even longer if the vaccines we're going to get out of this right now. Because, I mean, all signals we see is that this pandemic on a global level is going to get worse before it gets better. I think there is a number of different parts of the world where it's still progressing very much in the wrong direction. Europe not being one of them, for sure. I mean, after China and a little bit in the Far East, I mean, Europe has really been the epicenter of this early on, and then for a while a bit calmer in Europe, but now we are back as being kind of the epicenter of this disease. And we'll see if the rest of the world will follow the same pattern as Europe, to have a really bad first period, then a fairly calm period after a lot of interventions and a lot of lockdowns, and then once again, what we are facing now in Europe, a very difficult period with an exponential spread of the virus. Initially, not so much of cases coming into hospitals, not so high mortality, but unfortunately we're seeing signs of that are now following a few weeks into this. So I think in Europe, we're definitely going to have a very difficult winter, and we'll see how well we'll be able to handle this. A vaccine might make a difference when it comes, but we don't know when it will come for sure yet, and we definitely don't know how we can use it the best way, because many of the vaccines we are now seeing under development are based on technologies that we have not really used extensively before. So the exact effect of them is going to be a bit difficult to understand. I think for me also the big question is, why has this affected different countries so very differently? As I said, Europe has been hit very, very badly. Asia early on managed to get much more of a control of this. Africa is a very mixed picture, with many countries not being affected all that much, while we see in India the spread is very, very large. And I would very much appreciate Professor Leung's view on that, because we have discussed what is the effect of climate, what is the effect of crowding and so on. But the effect of crowding and climate seems to be so different in different countries. It's very difficult to understand. And is this just a question of time? Will also the slums in Africa be hit as bad as the slums we are seeing in India now? But once again, I think we need, on a global level, together find more sustainable solutions in place so that we can control this at a reasonable level. I think these three different forces that you were talking about are very important, because we can't handle them all at the same time. And I think very much in the discussion in Europe right now is about that. How can we both protect our health services, have a reasonable economic development, and control this virus at the same time, and keep the faith and the understanding and the trust from our population? That is not an easy puzzle to work with. And unfortunately, many countries in Europe right now, basically all of these things are going the wrong way. We are not controlling the virus. We are not getting any good economic development, and in many countries we are also losing the trust of the population. And that's something we really need to work more on to be able to handle. So altogether, I think we need to work even more globally together. There's been a lot of good things done, but probably even more could be done. I would especially very much appreciate more distinct evaluations of different interventions, both the positive aspects they have on stopping the spread of disease, but not least the negative aspects they have on other kind of health consequences for society, something we see in Europe very clearly now. We need to handle the travel in the world in a more reasonable manner. We have big problems in Europe now with different countries having different rules, which makes the population very frustrated, because 1 week you can travel across the bridge to Denmark and next week you can't. And I don't think that really builds trust in the population with those changes back and forth. And I really hope that we can get together on a global level and be able to use the vaccines that are now coming, the new therapeutics that are coming, in a good way on a global level, so we do really get a good effect of those. And I think last but not least, I think what we have done in Sweden is something what you talked about, Professor Leung, that we really try to concentrate on the high-risk settings. We've been regulating restaurants, big gatherings and so on, more than anything else, to reduce the spread in those spreadings, because that's very important to do. The cluster spread we see makes it rather difficult to evaluate things, because since clusters come very much without we are really being able to foretell when they're coming and not coming. I think a lot of the evaluation, you need huge amounts of data before you really can say anything when you have this kind of cluster spreads. So we need to do those, evaluate what are the real risk settings once again together, even if the context probably will be different in different countries. I mean, obviously public transport in Sweden looks slightly different than public transport in Hong Kong. And that would of course make the risk in public transport in Sweden quite different from the public transport in Hong Kong. But I stop there and looking forward to the questions.
Yeah, but one thing for sure is we are living under a global village, and so we need to work hard all together to find better solutions. And thank you very much for Dr. Tegnell for your insightful sharing. And here comes the question and answer section. And we have collected some questions from the public, and it's high time to learn from the two experts. And first of all, let's follow up on the collaboration globally. How much cooperation is there between experts, for example, in Asia and Europe? And how does experts around the world share knowledge and experience and discuss solutions? Do you talk to each other? Maybe Professor Leung, you can share your views first.
Well, I mean, the short answer is yes, we do talk to each other a lot. I've talked to about 8 or 10 national governments, ranging from fellow scientists to public health practitioners to deputy prime ministers. I've provided testimony to national parliaments in a couple of countries. And so we all, of course, share what we know and what we've observed with the World Health Organization. So yes, I think that there is a lot of goodwill amongst the scientific and the public health communities. And I think that that's the kind of spirit that we need to carry with us throughout the rest of this acute phase of the pandemic. And I think that we have another year or maybe even longer to go. And in fact, you will see that the WHO actually concluded their solidarity trial, the first analysis of that, about some of the treatment modalities, and concluded that nothing really is a magic bullet so far. And that has allowed us, given that the solidarity trial involved many, many countries, recruiting patients according to the same protocol and then analyzed together, that kind of collaboration has allowed us to say definitively that these 4 treatments probably don't keep us from dying. And they probably don't keep us away from being intubated in an intensive care unit. And so it allows us to then go on to the next set of questions. 1, would combination therapy work? 2, is there different timing of it? Perhaps some of the secret. And perhaps most importantly, is to allow us to move on to look at other possible treatments to see if they might be the silver bullets that we have been looking for, ranging from repurposing some cancer therapies or rheumatism therapies to completely novel monoclonal antibodies. So I think that that kind of collaboration is exactly what we need, and not least in the vaccine trials. And so it's still a very dynamic picture. And so I think that, you know, how and when vaccines are going to come out depends on the ongoing trials, but also the corollary effects when the first couple of trials start to report. Would that change the trial thresholds and the designs of the ongoing and subsequent trials? And how would that have a knock-on effect on deployment and distribution of these vaccines to the rest of the world? So I think that those still require a lot of detailed study collaboratively across the globe.
Yes, global cooperation is very important. I think, Dr. Tegnell, you agree with this point, right?
Yes, definitely. I've also had bilateral discussions with both experts and parts of governments with a number of different countries. And I think that's been very useful because sharing experiences, trying to understand both what works and what does not work is so important during this time. And of course, there's a number of platforms. WHO, I think, has in many ways done a fantastic job with bringing together different networks of people. And in Europe, we of course have our European Centers for Disease Control. We have a similar thing among our Nordic neighbors. So I think this crisis that we're in have really in many ways fostered a lot of more collaboration than we ever seen before. And I think that's very positive.
And the next question is about social distancing. As you may notice, I have a social distance with Professor Leung as well.
And you see there's a big gap.
Yeah,
here.
you're very free because I noticed that Dr. Tegnell is at his home. Yeah. Will I ever shake hands with other people, or etc. when we meet again, or is social distancing is some form here to stay? Because right now we used to bump elbows with each other as greeting, right? How's your thought, Professor Leung?
I think that will differ between different countries. I've talked quite a lot about this with colleagues and friends and so on. I think in Europe, that there's a strong feeling that we'll go back to shaking hands and maybe even hugging each other and so on, even if we are now getting better and better keeping social distancing. On the other hand, I think society needs to think about this a bit more, at least when it's possible, to try to build our cities, to build our transport systems, a little bit more thinking about that crowding is actually a problem. I think that has never really entered to the mind into most city planners and so on. So I think this will have effect, at least that's what the discussion goes here in Europe and so on the way we plan our cities, to make it possible to walk to work a lot more and generally to avoid the immense crowding we see in some places.
And how about Professor Leung? Are you used to bump the elbows?
I think that, as I said, it really depends on the context and the objective of your control measures. If you are in a place that can afford to and wishes to go for near elimination, then physical distancing will have a larger role compared to a place which is looking at just suppressing the viruses to such an extent that it doesn't overwhelm your health system capacity. So I think it will be different, but I do think that physical distancing of one sort or another to various degrees of intensity will be here with us for at least the next year and a bit. I think it will also prompt a reimagination for a lot of businesses as well as governments going forward, how we think about urbanization, how we think about delivery of services. And these things will have a very, very, very long ripple effect into the future. And I think that it is going to be sort of an era or epoch defining event. We will look back in history looking at COVID-19. It will be a defining event. Now, let me just say that whatever physical distancing that we do, and especially if we apply it quite intensively, we mustn't allow that to become socially distant. I think that we need to recognize that human beings are social beings. We need to be held. We need to hang on to each other. And I think that if we can't do that physically, then at least we have to keep up the emotional bonds. So while we may be physically distant, we must not become distant from each other socially or emotionally. And that is why whatever physical format it may take, we need to be socially together. And I think that that is a very often neglected part when we think about these lockdown measures as we go forward, because it is going to be for a prolonged period of time.
Yes, and that's why the government in Hong Kong, let me just say that we also encourage people to get in touch with your parents, your friends with phones, or just use video conferencing. It's also another kind of connecting. And so the next question, let's move forward, is that some netizens are worrying that we need to wear masks like us when traveling and in public areas for foreseeable future. Do you think so? Maybe Dr. Tegnell first?
Yeah, let me just quickly follow up on the earlier question, because I think you're so right. Actually, just the other day in Sweden, we decided to change our recommendations to our elderly citizens because they've been so isolated for a long time. We really see a lot of bad effects from that, and we open up the society for them a lot more than earlier on, making it possible for them to meet relatives and so on. When it comes to traveling with masks, I think for the next year or so, those things we're going to have to live with them. In the long term, I think, at least in Europe, the mask would go away. We hear so much, people are getting so irritated and so frustrated with masks in many parts of Europe. I have a hard time to see that it will be possible to have them enforced over a longer period. And then I talk in like 5-10 years into the future. I know that situation with masks in Asia, Japan, and so on has been different, and there has been another culture around masks. Right now, it does not seem to be really going that way in Europe, that culture would sort of be transferred into here. But travel with masks for the next year or so, most likely.
Yeah. Do you think so, Professor Leung?
Well, I think that first of all, masks work. Masks work not only to stop large droplets, direct transmission, or through fomites, that is contaminated surfaces because you've spit on it or you've breathed on it, but also for the occasions, and there are special settings where aerosols become airborne, and that could also be a route of transmission. I think the evidence is quite clear. The evidence is also quite clear that masks do work, but they don't work perfectly. I think that they are a necessary but insufficient measure to protect us. And therefore, as such, I think that they are here to stay for the acute phase of the pandemic. So that would be a year, maybe a year and a bit. Whether you will see universal masking beyond that, that is after the initial pandemic sort of really settles down with the help of vaccines, it really depends then on the particular setting. If you are in a very crowded urban center and that you still have quite a bit of activity of COVID, or for that matter, flu, or anything else, if you happen also to suffer the so-called syndemic of air pollution, particularly roadside air pollution, in some parts of the world, then it may well go beyond the year or two horizon. And I think Anders is absolutely correct. Japan has had a very long history, decades-long history of almost universal masking in certainly during rush hour in city centers like Tokyo, whereas in other places it has not been as culturally acceptable to do so. But I do think that COVID-19 may well change things. So for example, in the West Coast of the United States, in California, you saw a lot of people put on masks because of the fires in that particular state, really as a direct result of climate change. So I think that we need to take all that into account to see how we might cope in the future.
Yes, indeed. Wearing masks may be a new normal for people in Hong Kong, maybe for Europeans as well. And the next question is regarding travel. Is it effective and long way or long-term sustainable to close and control borders and quarantine all incoming travelers? Are these procedures here to stay, and for how long? But we haven't got a crystal ball, Professor Leung.
Well, I know when none of us have a crystal ball, otherwise we would be feng shui masters rather than epidemiologists. Very fine line, but there is a line. So travel restrictions, I think, is where the clumpiness of spread really comes in. So before COVID-19, there are very, very sort of established norms of the WHO and indeed many countries, tacit agreement that borders should not be closed because of an outbreak. Now, very quickly, the whole world found out that that didn't apply to COVID-19. And in part, it's because actually they have worked in many places, especially to stop the importation when they first happen and or during their respective peaks to reduce the possible caseload in ICUs. So I think it's indisputable that they've worked. The big question is, are they sustainable? Can you actually reasonably do this to make it compatible with modern life? And I think that those tensions, which I go back to my three-way tug of war, are beginning to show now for Europe and the US, that's probably past the 6-month mark, but for our part of the world, it's past the 10-month mark. So the strains are now beginning to show in terms of economic devastation and also the increasing fatigue of the population to comply with these measures. And so I think that what you are going to see is that rather than completely close borders, the big question is, what can we do to try to go back to a much reduced normal compared to pre-COVID, and yet still remain safe. So we're not talking about going back to 100%, but even if you go back to 50%, how do you make sure that you are safe? And I think the new innovations in the testing platforms, the availability of these tests, and how you deploy them, coupled with quarantine, or if you have got very similar epidemiology on both sides of the travel bubble, then you might even be able to do away with quarantine. I think that all these is really taxing officials in terms of being innovative and doing that risk trade-off. And there is actually a lot of fairly non-trivial mathematics behind it, but every country has been looking at this. And I think that you will very soon see various degrees of reopening of some borders, but you also will see a lot more deployment of testing to substitute for some of the effects of the border restrictions. And then you might also see some changes in the quarantine arrangements as well.
Yeah, Professor Leung has a crystal ball of the next question, because the next question will be related to travel bubble. But right now it goes to Dr. Tegnell first. Do you think that controlling border is a long way or is an effective way to curb the spread of COVID-19?
I think that the experience in Europe has been a lot less favorable than maybe you've had in Asia. There was a number of countries who really tried to have border restrictions early on. It did not work very well. The introductions was massive all over Europe in spite of border controls in Italy and other places. It was still introduced, probably because of the enormous amount of travel that takes place, and you can't really control it. And the European Union built so much on open borders that controlling borders, which has done to a certain extent right now, I'm not very sure it has really impacted the epidemic in Europe very much, but it has really impacted the trust from the population, the acceptance from the population. And there are already moments, I know, for example, in Norway, suing the state because they're closing the borders so that the Norwegians can't visit their houses in Sweden. So I think that's an important part of when you're talking about travel restrictions and how are you going to get an acceptance of the population to something. I don't think right now in Europe, I mean, we are more back to what we talked about here, that we have a fairly similar epidemiology in most European countries with a massive spread in many countries. And then insisting on staying with border restrictions is very difficult to explain. I mean, how can you from one country where you have a bigger spread in your own country say that you will not accept people from parts of other countries because you have established some rather arbitrary level of spread as a kind of indicator that it would produce some kind of difference to the spread of your disease. What will happen in the long term? I think in Europe, as I said before, we really need to come to some kind of common agreement among the different states so that the rules are not different between different countries and that the rules don't change every other week, because that's not sustainable and not workable. If we in the long term can find some kind of way of handling this, maybe a bit more similar to what we've done with yellow fever historically, with a combination of maybe vaccine certificates, better fast testing and so on. If we again end up in a situation where the epidemiology in different countries are very different, but it is a very difficult way to stop. Even in Iceland, you know, the small island in the north of Europe, for a time managed to keep the disease reasonably outside of the country. In the end, they failed, and now they have big outbreaks. And then they did enormous efforts with quarantine of everybody coming there, testing of everybody several times. And even so, this disease managed to sneak through and produce outbreaks. So I think we need to go back and wonder how much are we really, is this really worth in both exact costs in money, but also in trust and acceptance from the population to keep borders closed over the long term.
Thank you very much, Dr. Tegnell. As mentioned, the next question is about travel bubble and is specifically for Professor Leung. And the government in Hong Kong just announced a potential travel bubble with Singapore. And what do you think about travel bubbles? And is this a viable way to satisfy people's desire to travel and facilitates the economies in two places?
All right, my view is this. I think that we need to plan for the long run, because we are going to have to live with this for the next 12 to 18 months, I think. And so we can't sort of cease all travel, because there are some essential travels, whether it's for sort of key business activities, trade activities, or for that matter, for family emergencies or really important family business. So I think that that's, you know, not even including mass market tourism. So casting the mass market tourism, which I think is not probably a particularly safe idea at the moment, even when you're talking about essential travel, you are talking about, you know, quite a bit of volume. Travel bubbles can be safe, but please remember that it's never a bilateral sort of travel bubble. It's never a bilateral affair only, because usually if you are talking about you know, Hong Kong and Singapore specifically, both are international travel hubs. Both have a lot of connections with a lot of places. Both have a lot of transit passengers who don't even actually step foot in that particular place, but they only use it as a transit hub. Both have multiple modes of transport and connections beyond just air travel. And so you're really opening up to not only your direct partner in that travel bubble, but also all their partners in their networks. So I think that what you would have to expect and to plan for is that it's not just between the two places primarily, that you would be having a lot of these corollary, perhaps unanticipated or even unknowable effects. And therefore, what you need to do, if you want to do it very safely, because both places are still going for near elimination, then you will have to do massive testing and some degree of trust in terms of the quarantine and the sensible behavior of these limited number of travelers would have to go along with this travel bubble arrangement. Otherwise, what you will see is very quickly, these importation seeds will grow, and then you will see pressure on both sides to actually close it down. And that's the last thing you want to see, because to try and take that initial leap of faith, I think requires a lot of goodwill. And if that doesn't work, or if it only works for a very short period, you almost destroy the confidence and the trust that has been so invested in it by both governments and both peoples. And so I think that we have to be very careful, but I do think that it is a sensible way forward to deal with this new normal, but just make sure that we put belt and braces on at the same time.
To Dr. Tegnell, do you think that the concept of travel bubble can be applied to EU, and is there any similar discussion?
Yeah, I would say to a certain extent the discussion has started, not maybe exactly the way you have handled it, but more on, as I said before, on agreeing on common rules of travel restrictions, i.e. how do we find high-risk areas, and what will be the measures when you move from a high-risk area to low-risk areas, so that at least we come out of a common set of sort of rules, procedures in place, which I think would make things a lot easier. There has been some small tries to create bilateral bubbles, but the problem is that at least in Europe, the epidemiology has changed so quickly, so that what looks like a more or less common epidemiology one week, the next week shows that it's again very different, and that has not made it possible in the long run. So I think the closest we can get to some kind of travel bubble in Sweden, in Europe, within the European Union, is to establish a common set of rules and regulations on what does apply when you move from one type of area to another type of area. And there's, I mean, in Europe, there's a lot of good data on that. We can actually break down our data on regional level to a great extent, which and give good data. The problem with this is that the data we're looking at is always showing the situation like it was a couple of weeks ago. And with a quickly changing epidemiology in Europe, you can really wonder, does this make sense? Because one area that in Germany looks safe, when you look at the data, actually when you travel there, the spread might look completely different than it did 2 weeks ago, which the data is actually showing. So there is problems with this, and we'll see how far we can get.
Yeah, and Professor Leung has mentioned testing as well. And in Hong Kong, we just went through a massive testing program named the Universal Community Test Program, UCTP. Is it an effective way to control the pandemic? And doesn't it have to be done in parallel with comprehensive contact tracing in order to be effective, Professor Leung?
Well, I think that testing and tracing always go hand in hand. So I think that I would probably characterize sort of the mass screening approach that mainland China has very successfully deployed in many of the cities as, yes, I think that it is potentially a very effective strategy, but also it carries a lot of preconditions for success. The preconditions would be that you have a very willing population who would agree and accept this as a measure to combat the pandemic, that you can do it very quickly, and that you can do it very comprehensively and do it well, which would require massive laboratory capacity to process, as well as swabbers who actually go and take the samples in a competent and in a safe manner. So I think that these preconditions can only be met, quite frankly, in very limited places or countries around the world. Mainland China being one of them, and Hong Kong has tried in our own way to do it to try and hasten the conclusion to the third wave of our own pandemic. And so I think that we need to recognize that for every measure that we implement, that there are pros and cons, and they are probably, for some of these measures, they're very contextually specific. They are not a one-size-fits-all strategy that everybody can do, just like the Swedish approach cannot and should not be applied to some other countries, whereas it may fit the Swedish context more appropriately. So I think that we need to, while we share and learn from each other's experience, also understand the deep, deep reasons why it might or might not work in that particular setting, and then consider those preconditions and prerequisites before wholesale adapting or adopting these measures in your own place.
Yeah, culture and constraints are different. And to Dr. Tegnell, is mass testing of the population something that is being discussed in Europe, and could it work?
I think it has been discussed, but I think to a great extent is that really have been understood because exactly what different politicians and people have meant with mass testing has differed very much. I think it's very important, like was just said, that testing, you can't just look at testing as a laboratory procedure. It includes a lot of other things. It includes somebody who has to swab, somebody has to take the results back. You need to have the acceptance by the person tested to follow certain rules that comes with positive tests and so on. So it's a complicated thing, and you need to have the whole chain in place, including the contact tracing and the measures after that, if it should be worth our while. To do that on a massive scale, I would say in most European countries is not doable. We do a kind of mass testing when we see outbreaks in nursery homes and hospitals and so on a very limited scale in that context. And then, of course, it's a very useful procedure. But to do a mass testing on a population level, I don't really think it's going to work anywhere in Europe. I think Germany is probably the one country in Europe who has tested the most, but that has not been in a term of mass testing in the way that we talk about now. It has been a very focused testing and contact tracing around positive cases and around outbreaks. And that's, I think, is a very essential way, and a way that I think many times has worked very well with COVID-19, this classical way of testing, contact tracing, both forward and backwards, to find the clusters that are so important to find and to limit quickly. So in that way, testing is very, very important, but mass testing of big parts of the population, no, I don't think that's the way forward. And it's not really discussed seriously in Europe anymore.
Yeah, because we have only 4 minutes left for this webinar. And so last questions to you both. Any last words to your colleague or the audience? Maybe Dr. Tegnell first.
First of all, thank you very much for having this very interesting discussion together. I think it's been very fruitful. I really believe very strongly in that these kind of exchanges on the international level are so important, even if it's also true that we need to take the lessons with us back home, think about will they work in our context or not. But that I think is crucial that we keep on sharing our experiences, because I think that's the only way that we're going to find a new normal, a new way of living with this disease without it letting us hurt our societies far too much, which I think has been true in, at least in Europe, in many parts, that this is hurting the whole society so much right now. We really need to find a way out of it.
How about you, Professor Leung?
I think that behind and beyond all the science and the public policy and even the politics, we must remember that there is a human being at the end of every single policy, every single research paper. And we have already witnessed and experienced the gravest single health inequity in the past century. And mostly this time, so far, it has been by omission. That is what we have not done proactively to prevent that from happening. But I think the real test of global solidarity and really our sense of humanity is what we do going forward by commission, and specifically in how the world, specifically those who have vaccine development and manufacturing facilities, how those 20 or so countries are going to make sure that vaccines, when they become available, are fairly, justly distributed and deployed around the world. We are, after all, only as safe as those who are in the most hazardous situations around the world, as we have already witnessed. No country has been spared. No corner of the globe, no matter where you are, has escaped from COVID-19. And let us hope that we will have a renewed sense of our own sense of fairness and justice going forward to try and help the world exit from COVID-19.
Thank you very much. And when the coronavirus pandemic started early this year, it was surrounded by a lot of uncertainties and a lot of rumors. And the discussion today shows that we have come a long way since then. Thank you very much, Professor Gabriel Leung and Dr. Tegnell, for taking time to talk to us, for sharing and your valuable opinions and insights about the pandemic and its future development. Last but not least, if you find this webinar useful, please like and share to your friends, and let's stay strong and healthy amidst the pandemic. If you missed some part of it, you can also watch it again on the Swedish Consulate General's YouTube channel, and you may wish to find a link on their Facebook page. Looking forward to seeing you all again next time. Stay safe and have a nice weekend. Goodbye.